Question period. I recognize the Leader of the Opposition.
This tired and out-of-touch government is failing to deliver on health care.
Hear, hear.
Gwen Gilbert, who's joined us today, has been looking for answers since her daughter, Andrea Parmar, died in the Yorkton Hospital. Andrea was a psychiatric nurse, counsellor, writer, and motivational speaker from Langenburg. She was admitted on March 28, 2022, to the Yorkton ICU, where she tragically died 4 days later. Gwen and her family met with the former health minister earlier this spring, but they still have many unanswered questions about what happened to Andrea. Mr. Speaker, why has this family had to wait so long to get answers about what happened to their daughter in this province's healthcare system?
Recognize the Minister of Health.
Thank you, Mr. Speaker, and I would begin by extending my condolences to Gwen Gilbert and the family of Andrea Parmar, Mr. Speaker, and thank them for being here today. Mr. Speaker, while the Health Information Protection Act prevents me from getting into the specifics of patient cases on the floor of the Assembly, I can confirm that I will be meeting. We have a meeting scheduled for tomorrow with Gwen Gilbert and family members to discuss this further. Mr. Speaker, as the Leader of the Opposition mentioned in her questioning, the previous Minister of Health, the now Minister of Corrections and Policing, did meet with the family back in the spring, and also, I understand, visited the Yorkton Hospital and talked to staff and leadership there, specifically about this case, Mr. Speaker, and I believe that there have been some answers provided. But again, I will be meeting with the family tomorrow to have further conversation about the circumstances around this tragic passing. Thank you, Mr. Speaker.
Recognize the Leader of the Opposition.
Mr. Speaker, Gwen and her family believe that Andrea didn't get the care that she needed. They want to know why Andrea wasn't intubated, why she wasn't seen by an internal medical specialist that night, and why there was no effort to transfer her to Regina when it was clear that her health had begun to deteriorate. As mentioned, she met with the last health minister in May. Commitments were made at that meeting, but they haven't been followed through on. When will the minister get this family the answers that they're looking for? And Gwen would like to know, when will there be accountability and justice?
Recognize the Minister of Health.
Thank you, Mr. Speaker. And when we sit down tomorrow to meet with the family, I look forward to having a conversation about the information that I understand. My understanding has been provided already, but also recognizing that there may be some additional questions here. And I will endeavour, as Minister of Health, with our team to follow up on any of these outstanding issues. Mr. Speaker, the ministry doesn't have access to patient records. I believe that, and I just stand to be corrected, but I believe that there has been some follow-up or contact between the family and various self-regulating bodies around care and what happened around the circumstances of this case, Mr. Speaker. But again, we'll be sitting down with the family tomorrow to have a further conversation about the circumstances around the passing of Andrea and next steps forward, Mr. Speaker.
Recognize the Leader of the Opposition.
Mr. Speaker, Gwen shouldn't be getting updates from the floor of this Assembly about what happened as a result of those meetings. Understandably, she wants answers about the night that Andrea died, but she also very clearly wants to make sure that this doesn't happen to any other family in this province, in our healthcare system. Andrea wasn't seen by a doctor the night she was in the hospital. And as we know, short staffing has unfortunately become the norm across the healthcare system. What specific changes will the Minister of Health be making to ensure that what happened to Andrea will not happen to any other person in our healthcare system?
Recognize the Minister of Health.
Thank you, Mr. Speaker. And in addition to what I'm aware of currently, but follow up to the meeting that we'll have with the family tomorrow, the SHA would take every effort to ensure that there is the appropriate follow-up that is done when it comes to an incident such as this critical incident, Mr. Mr. Speaker, I believe there would have been an investigation into all of the circumstances around this case. There would have been recommendations made for changes and improvements to be made to prevent such an incident from ever happening again in one of our healthcare facilities. Mr. Speaker, I will seek follow-up again and reassurance from the SHA that there have been recommendations made and that they are being followed up upon, and that they are being implemented not just in this particular case, but as a result of this case, to strengthen the healthcare system to, again, prevent such a situation from ever occurring. Thanks, Mr. Speaker.
Recognize a member from Regina University.
Thank you, Mr. Speaker. Gwen is a constituent of mine, and she's here with her friends, and she's also held up by her family and the community of Langenburg who stand behind her, and she's been tireless in her pursuit of truth and answers about what happened to her daughter, Andrea. When we met with the last Minister of Health in May, he undertook to provide answers in 30 days' time. It was a good meeting. It was a sincere meeting. I believe that. I have followed up regularly and respectfully on behalf of the family. And when the new Minister of Health was appointed, I reached out to him. And he was included on all of the original correspondence as the former Minister of Rural and Remote Health. So I'll ask the Minister today, did he keep his promise to visit the Yorkton Hospital, and did he investigate?
Recognize the Minister of Health.
Thank you, Mr. Speaker. As I indicated previously, the former Minister of Health, the now Minister of Corrections and Policing, met with the family, I believe in May was the date, Mr. Speaker, and then did tour and visit the Yorkton Hospital, I believe, Mr. Speaker. And again, as I said earlier, met with leadership and officials at that point in time to speak specifically about this case, Mr. Speaker. And again, I will be having a meeting tomorrow with Ms. Gilbert and the family to have further conversations. It's also my understanding, Mr. Speaker, that the previous minister did have a letter sent to the family, I believe in late June, Mr. Speaker, around some of the questions that would have been answered. But again, we will meet with the family tomorrow and have further discussions about other answers that they would be seeking, Mr. Speaker.
Recognize a member from Regina University.
Thank you very much, Mr. Speaker. The Minister is right. We did receive a response after a number of follow-ups, and we did receive a meeting for the last day of session, again, after months of follow-up, just like what happened in the spring. Mr. Speaker, Gwen and her family have done everything that normal people could be expected to do. They've gone to the director at the local hospital, the patient advocate, quality care coordinator, the registrar, the college. They have gone above and beyond what any normal person should be expected to do, seeking answers and justice. The state of healthcare in Saskatchewan is leading to tragedies. So again, Mr. Speaker, this family is looking for action. Will the minister commit to getting to the bottom of what happened to Andrea and ensuring that nothing like this happens again, because it has been months of patient, nonpartisan, respectful advocacy?
Recognize the Minister of Health.
Thank you, Mr. Speaker. And as I said previously, we will meet with the family tomorrow again. I understand that there was a letter sent by the former minister in late June identifying responses to a number of questions. That being said, Mr. Speaker, I'd be willing to sit down when I do tomorrow with the family to have further discussions about unanswered questions that they may have, Mr. Speaker. Some of those may be required to be, the answers may be required provided by the SHA, by the regulatory bodies, perhaps involving the self-regulating professions when it comes to standards of care. As I said previously, the SHA in our health system has a process in place for critical incidents, and how those are investigated and recommendations are made and are followed up upon, and we will have that discussion with the SHA about progress being made thus far, Mr. Speaker.